video, we're going to walk you through the proper technique on obtaining vital signs in an adult. It's so important that you use the correct technique in order to obtain accurate results. So the 5 vital signs we're going to review are temperature, pulse, respirations, blood pressure, and SpO2 or pulse oximetry. So to take an oral temperature, you're going to remove the probe from the thermometer and attach a probe cover. Place the probe in the pocket under the tongue and have the patient close their mouth. Make sure they haven't had anything to eat or drink in the last 15 minutes because that can really mess with your results. Normal temperature for an adult is 97.8 to 99.1 degrees Fahrenheit. Now, in some cases, you may need to take an axillary temperature. So place the covered probe under the patient's arm in the axilla and have them place their arm by their side. Make sure you get good contact with the skin. Now, while this isn't the most accurate temperature, it usually runs a full degree lower than oral, it's still a good option if the other routes are unavailable. You could also use a temporal thermometer or a rectal temperature if it's appropriate. So after you take the temperature, you want to take the pulse, which is the number of times the heart beats in 1 minute. Normal for an adult is 60 to 100 beats per minute. Now, when checking a pulse, you have a few options. The first is the apical pulse. To get an apical pulse, you're going to place the diaphragm of your stethoscope over the apex of the heart, which is the 5th intercostal space mid-clavicular line. And you're going to listen for a full minute when you listen for an apical pulse. This is especially helpful for patients with abnormal heart rhythms like atrial fibrillation. So the reason that is important is because in atrial fibrillation, their rhythm is abnormal. So if you count for, say, 15 seconds and multiply it, you're not necessarily going to get an accurate result. So by counting for a full minute, you know that you've gotten their actual beats per minute. So another option that you have is to obtain a radial pulse. To get that, you're going to find the groove just below the thumb on the inside of the patient's wrist. You're going to palpate the pulse and count for 30 seconds and then multiply by 2. This is going to give you beats per minute. Now, you could also count for 15 seconds and multiply by 4. But again, for very fast rates and abnormal rates, you want to get as close to a minute as possible. The other thing you can do is obtain a carotid pulse. You're going to place 2 fingers on the thyroid cartilage in front of the neck and slide them to the side into the groove just below the jawline. Again, palpate for 30 seconds, multiply by 2. One important thing to know here is that you should never palpate both carotid arteries at the same time because you can cause a vasovagal response. The next thing we want to do is obtain a respiratory rate. Now, when you're obtaining a patient's respiratory rate, it's really important that you don't tell them you're counting their breaths, otherwise they're going to breathe differently. So one trick is to count the radial pulse for 30 seconds, and then while still holding the patient's wrist, count their respirations for the next 30 seconds, and again, multiply by 2. So the next thing we'll do is get a blood pressure. Now, this isn't always as easy as just slapping on a cuff and hitting start on an automated machine. Sometimes we have to take it manually. So first things first, patient should be upright, legs uncrossed, and arm at heart level. Then you want to make sure you have the right size cuff. Wrap the cuff around their arm and look at those range markings. If you need to, get a different size. Then you're going to palpate for the brachial pulse on the inside of their elbow and wrap the blood pressure cuff around their arm with the indicator line pointing to that brachial artery. Now you can add the meter or the sphygmomanometer where you can see it, and then you're going to want to put on your stethoscope and place your stethoscope diaphragm over the brachial artery. Now make sure that the valve on the bulb inflator is closed, and then you're going to want to inflate the cuff by squeezing the bulb until you can't hear the brachial pulse anymore, which on average is usually between 160 and 180 millimeters of mercury. Or you can inflate to about 30 to 40 millimeters of mercury above the patient's baseline blood pressure if you know it. Then you're going to carefully open the valve very slowly and begin deflating the cuff at about 2 to 3 millimeters of mercury per second. As the pressure drops, you're going to start hearing a boof sound. That's the pulse. So take note of the pressure at that moment when you hear it the first time. That is the systolic blood pressure. Keep deflating until the pulse sound fades and you don't hear it anymore. At that point, it is your diastolic pressure. Just be careful that you're not just watching the needle bounce. It won't be accurate that way. It has to be what you hear. So this takes a lot of practice. So grab a friend and practice on each other. Make sure you document and write down a blood pressure because sometimes they're harder to remember. So next thing we're going to do is our pulse oximetry. Big thing you want to do is make sure your patient's fingers are nice and warm. You can even wrap them in a warm towel if you need to because you need good circulation. And also we don't want them to have nail polish on. Just apply the probe with the red light on top of their fingernail. You should get a result in about 5 seconds, and that's the number you're going to document. If you're still having trouble with circulation, you can try a different hand, a toe, or you can even use probes for ears and noses as well. Last but certainly not least, document your vital signs. So I hope that was a helpful review on how to take a set of vital signs on an adult. Truly, the more you practice, the better you're going to get at it. So keep doing that. Practice on a friend. All right, guys, go out and be your best selves today. And as always, happy nursing.